many people think of hypnosis, they think of the Lon Chaney, Bela Lugosi movies of the 30s, where the beautiful girl is put under the power of the evil professor. Well, that's not really the case. The roots of hypnosis go back to physicians in the 1700s and 1800s. In those days, most hypnosis practitioners were doctors. Doctors later on distanced themselves from hypnosis when charlatans began using hypnosis in stage shows. It may interest you to know that in the 1850s, a Dr. John Elliotson, the inventor of the stethoscope, performed some 2,000 painless surgeries ranging from amputations, appendectomies, tumor removals, bowel resections, prostate surgery. His only anesthesia was hypnosis. Across the English Channel, Dr. James S. Daly was doing the same thing. Same operations. His only anesthesia was hypnosis. On the mental front, a Dr. Jean-Martin Jarcot was treating patients with something he had named hypnotherapy for what in those days was called hysteria. And across the ocean, doctors on both sides in the Civil War were operating on patients with hypnosis when they did not have ether and they did not have laudanum. Actually, it was found that this was safer because in those days there was no such thing as a blood pressure cuff. Sometimes they administered too much ether, too much laudanum, and the soldier died. Today, medical schools are teaching hypnosis. Some dentists are using hypnosis for painless root canals. And the top burn centers in the country are beginning to use hypnosis for pain mitigation. You see, morphine constricts the blood flow to the skin, and it slows down the blood that goes to the skin and the skin grafts, and it impedes and it slows their recovery. I'm Bob Crow. I'm a behavioral therapist that is board certified in clinical and medical hypnosis. People come to see me for permanent weight loss, to stop smoking, for performance enhancement in sales, public speaking, and different types of sports. But in addition to those issues, people come to see me for medical problems, such as alcoholism, Asperger's syndrome, to alleviate the nausea and fatigue from chemotherapy, fibromyalgia, irritable bowel syndrome, schizophrenia. Stress can not only affect people mentally, but physically as well. We're not advancing hypnosis as a cure for cancer or to heal a impacted wisdom tooth. But hypnosis can be used to alleviate the nausea and the fatigue from chemotherapy. It can be used to perform a painless colonoscopy, and it will enable a dentist to most definitely perform a root canal without anesthesia. We also don't claim that hypnosis will cure diverticulitis, one of the many manifestations of irritable bowel syndrome. But in 85%, that's 85% of the people who sought relief through hypnosis for irritable bowel syndrome, again, 85% became symptom-free. There's an area of our subconscious called the autonomic nervous system. It regulates blinking your eyes, breathing, pulse, digestion. It also controls smooth muscle tissue, such as the heart and the glands. But it's also noteworthy that it is part of the pain matrix of the central nervous system. Stress causes sickness. Stress wreaks havoc with the immune system. Stress will bring on many types of system. Stress can best be dealt with in the subconscious mind. Doesn't it make sense to deal with items that may cause us illness at the center, and that is in the subconscious mind? It's only in our subconscious mind that we can access the alpha and theta brainwaves and thereby change our behavior. The only way to access our subconscious mind deliberately is through hypnosis, as hypnosis is the bridge to the subconscious mind. If you think that you may have an ailment or syndrome that is emotional in nature, give me a call. My areas of specialty in behavioral therapy are clinical and medical hypnosis. Give me a call for a complimentary consultation.